Welcome friends to PACS India 2018. I heartily welcome Dr. Sameer Gupta, an interventional cardiologist working with the metro groups of hospitals. Hello sir. Sir, could you please throw some lights on cardiac sarcoidosis, the symptoms, the signs, how to diagnose cardiac sarcoidosis, and what is the treatment available for cardiac sarcoidosis?
Of course, thank you so much for having me here. So, today we had a big discussion on cardiac sarcoidosis, and we talked about the multidisciplinary approach to treating this condition. Sarcoidosis is, I'm an interventional cardiologist, so most of the patients who come to me are patients who have already been diagnosed with sarcoidosis of a general, of some other organ, whether it's the lungs, whether it's the eyes or the kidneys or some other organ, and then they're usually sent to me for diagnosis and for further management. Now, cardiac sarcoidosis is not uncommon. In fact, they say that about 25% of all patients with pulmonary sarcoidosis have cardiac involvement. Whether that is clinically active and clinically significant is not always there, but 25% of all patients with sarcoidosis, with pulmonary sarcoidosis, have cardiac involvement. And about 5% of all patients with pulmonary sarcoidosis have active cardiac sarcoidosis. That means that they're having some clinical manifestations of cardiac sarcoidosis. Now, whenever you're concerned about cardiac sarcoidosis, what you do is you do a very good history, and you typically ask these patients. You do a screening exam. So you do a screening exam in which you look at the history of the patient. You ask them for various, whether they've got dizzy, lightheaded. You ask for syncope, pre-syncope, palpitations. Now, these are some warning things. These are some important points that come out, and then you further screen them with an ECG and an echocardiogram. In an ECG, you're looking at whether there is any bundle branch block, there is heart block, there is arrhythmias, there is ventricular tachycardia. These are things you're looking for in an ECG, and even in a Holter monitor for that matter, if they have a history of palpitations. And then you'll do an echocardiogram. An echocardiogram, you're looking for whether there's any regional wall motion abnormality, there's thinning of the septum, and so on and so forth. So there are some of the things you're looking for in basic screening for any patient who has pulmonary sarcoidosis or any other sarcoidosis. So you do a screening with once again with the history, with ECG and an echocardiogram. If any of these features are abnormal, so if there is a history of palpitations and then you have an abnormal ECG or an echocardiogram, you go for the next step in diagnosing these patients, which includes a cardiac MRI or a PET scan. Now, there's a lot of controversy which one to do first, whether you should do a cardiac MRI or you should do a PET scan, because they both look at two different pathologies, or they do at different aspects of the disease. When you're doing a cardiac MRI, you're looking for inflammation, you're looking for scar, you're looking for the wall motions. But with the PET scan, you're looking for active inflammation. So there's a lot of controversy, and that once again can go back to where you're treating, what are the facilities available. If there's a good somebody who reads good cardiac MRI, then cardiac MRI would be a treatment of choice. If you're doing a PET scan, then if you have somebody who's good at reading cardiac PET, that may be your test of choice. Now, once you've diagnosed somebody with cardiac sarcoidosis, then the treatment typically includes immunosuppressive therapy, and you would use steroids. And if the steroids are not, and you give 0.5 milligram per kilogram is what you typically use. So for an 80 kilo male, it will be like 40 milligrams of prednisone every day, and you do that for a few months, and then you follow these patients up with regular PET scans to see, has the disease pathology, has the inflammation come down, has it gotten better. And also, if you have any heart block, if you start having arrhythmias, then you start thinking whether this person needs a pacemaker, and if this person needs an ICD, and so on and so forth. So that's just a basic summary, a bird's eye view of cardiac sarcoidosis. How do you treat it? How do you screen it? How do you diagnose it? And then how you treat it. Hope I answered the question.
It was a pleasure to hear you, sir. Thank you for sharing your experiences and also your time. So thank you so much.